October 21st, the president cited the story of Jessica Sanford, a Washington State woman, as a success story. She was thrilled. She had checked into getting health insurance. She's a court reporter who has a son with ADHD, and she was quoted a price that included a subsidy, and she was very happy because she was going to be able to afford insurance. She's now spoken to CNN. She's found out actually that she does not qualify for a subsidy. It was revised down once. She now doesn't qualify. And she simply cannot afford the insurance. Now I'm wondering what the president's message is for her, having used her as a success story, and obviously for a number of people who are in a similar situation.
Well, first of all, as I know you, I think CNN included in its report, but not in that question, is that the Jessica Sanford is working with a state-based exchange, and
it was the state exchange who,
right,
who quoted her.
And we're obviously, I saw the news coverage, and I don't know whether or not the details are correct, but I can tell you that my understanding is Washington State health officials are reaching out to Ms. Sanford to make sure she has accurate information about her options, and I'd refer you to the Washington Health Benefits Exchange for more details. And now, while that state exchange has done a lot of things right, we also know that they have recently had problems with errors in tax credit estimates, and we're certainly as sorry as we can be that Jessica is one of the folks that has been affected by this, if that's the case, as reported. I think also it's important to note, again, as the state exchange looks into her personal situation and makes sure that all the numbers are accurate when it comes to whether or not she qualifies for a credit. That Jessica,
you think she may qualify for
no,
credit?
I'm saying I have no idea.
I'm
saying that she got.
That she's someone who it appears now she doesn't, and yet it's very expensive for her, and she's saying she cannot afford it.
Again, I don't know the numbers about what her income is, what the coverage cited to her is. I know based on your.
I mean, the president used her story.
Absolutely, based on what she told the president, what she told the White House, she had been told by the state exchange when she was initially told she would get a subsidy, and therefore the coverage would be less expensive than what she's being told now. In either case, this is not the federal-run marketplace. This is a state-run exchange, so we don't have.
The concept of her being an American.
Brianna, if I could just finish my
subsidy.
sentence for one.
If she can't
Sure.
afford it and she doesn't qualify for a subsidy, and she's
And what
in
I'm
this
saying, Brianna, is
predicament.
I don't know her personal circumstances, and it's my understanding that Washington State Health Exchange officials will reach out to her to make sure that the information she's gotten is correct, because there has been, with her in particular and with other individuals in Washington State, instances of errors in the information they've been given, and that's what led initially to her believing that she would get a tax credit, and then to at least the current information that she won't. What I think is also noteworthy, and I saw it in your report or CNN's report, so I'll mention it now, is that she says she's still a supporter of the Affordable Care Act. And the Affordable Care Act is designed to give access to millions of Americans who, like her, have never had insurance before or have been uninsured for a long time through affordable quality health insurance. Again, I don't know her personal economic circumstances or what is affordable for her, but there is no question that, again, based on your reporting and our understanding of what she's told us before, that she did not have insurance before, was uninsured before.
She said she was a supporter of the ACA, but she also feels that she has not been served well by the ACA. So what is, I guess that's the response I'm looking
what I
for.
can tell you is that, again, I don't know her personal circumstances. I don't know her income level or her, what goes into the calculation of whether or not she gets a tax credit. What I can tell you is that she did not get insurance at all. She was uncovered. She was uninsured, one of the 15% with zero coverage. And whether, well, again, I don't know her personal circumstances, but when we're looking at the fact that the Affordable Care Act would increase coverage in this country by tens of millions, the fact is that the status quo means that 15% of the population remains uninsured, and that 15% grows, because that has been the case over decades now, since the last effort to reform healthcare in this country, where the ranks of the uninsured have increased, where employers over years were shedding coverage, and premiums for all of us were going up. Healthcare costs were skyrocketing, and now for the first time in 50 years since data has been reported, healthcare costs are growing more slowly than ever.
But some people, like Jessica, may just fall through the cracks.
Well, again, I don't know her personal circumstance, so I can't keep, you know, guessing based on what you tell me. I can tell you that the Affordable Care Act is designed